Hi guys, in this video I would be showing you very quickly what a basal cell carcinoma looks like when you place a dermoscope on a lesion. Excuse me. So when you place a dermoscope on a lesion, the question you're asking yourself is this lesion very likely to be benign, or is this lesion more likely to be suspicious for a possible skin malignancy? And one of the fairly common skin malignancies you will see around is the basal cell carcinomas. A lot of basal cell carcinomas are known to occur more on the head and neck areas, but sometimes they could occur or they could be found, on the trunk and limbs. Um, and let's have a quick look at some of the things that would help you identify a basal cell carcinoma on a dermoscope. So common things we'll identify would be telangiectasia, which are just these, blood vessels, increased vascularity, increased vascularity, really small capillary vessels that you could see in the lesion, the maple leaf-like areas and leaf-like areas which resemble maple leaves, very small, funny shaped kind of leaves. So things like these areas of darkening, usually at the periphery of the lesion. We'll see much clearer images very shortly. You could have some comma-shaped vessels. There could be ulceration, in the lesion. Any malignance in the skin lesion can actually ulcerate. So a squamous cell carcinoma can ulcerate, a basal cell carcinoma can ulcerate. And these arborizing vessels, which of course resemble the telangiectasia, arborization simply means branching. So we have lots of branching blood vessels, quite commonly seen in basal cell carcinomas. From my personal experience, I did a basic, not intermediate, basic dermoscopy course. And since then, my confidence in identifying suspicious lesions, have greatly increased, markedly increased. And one of the most common features I notice when I see lesions that are very likely basal cell carcinomas are this arborizing blood vessels, and of course the maple leaf-like areas. Yeah, these are the most common features I've identified. Here's another photo. So just to give credit, these photos are not mine. I snipped them from the internet. So just for copyright sake, I need to state that. So you can see some spoke wheel-like structures. So this spoke wheel, some people will describe this as a maple leaf. You can see the maple leaf-like areas. So they look like maple leaves, usually at the periphery, some areas of hyperpigmentation that look like maple leaves. Um, when they are smaller, when you look smaller, then you can describe as spoke wheel, or someone could still describe this, spoke wheel as a maple leaf. Other things you could see are the blue-gray ovoid nests. In fact, I recently referred a patient because I identified this blue-gray ovoid nest within her skin lesion. So it's something you could actually see as well, or what we call the blue-gray veil. You could see that blue hue when you see a lesion on the skin. It might be difficult to see these in dark people, in Africans, dark Africans, or Black Americans. It's more, most of these features are described using Caucasian skin. Most of these features you can see we're talking about are described using Caucasian skin. So the features may be very different in a dark African skin, because in dark African skin, erythema, for instance, would appear as hyperpigmentation, further darkening. So most of these features are described using Caucasian skin. Let's carry on. So brown dots in focus, you could have some brown dots, very likely, very common features, arborization, your branching vessels. You can see arborizing vessels. You can see how this blood vessel here is branching. You can see lots of branching, lots of vascularity, going on within this basal cell carcinoma. Shiny white structures. You can also have this whitening, which actually indicates, a destructive lesion. So when you see this whitening, sometimes it could be from scarring, okay, from fibrosis or tissue damage. Okay, so ongoing tissue destruction and fibrosis or scarring could be going on. But the things that are most common that you should be looking out for branching blood vessels, arborizing blood vessels, these maple leaf-like areas, usually at the periphery, or can appear as spoke wheel, okay? And then this blue-gray hue, or it looks like a blue veil, a transparent blue veil has been placed above the lesion. You can see those areas that look slightly blue, very pale sky blue veil, over the lesion. Even when you look at these spoke wheel area, you can see there's some bluish hue to it. Okay, so when you're seeing things like that, it should be telling you that, oh, maybe this lesion could be a basal cell carcinoma. This picture typically illustrates what arborization or branching of blood vessels, which simply indicates, increased vascularity in this basal cell carcinoma. Um, so when you look at other malignancies like melanomas and squamous cell carcinomas, even though, of course, there is increased vascularity in those lesions, you don't see arborizing blood vessels. So if you're seeing arborizing blood vessels, it tells you that this lesion is most likely, or very likely, to be a basal cell carcinoma. In this lesion, you can see this blood vessel, not so much arborization, but of course, there's arborization there. You can see at the periphery, of course, this lesion generally, you can see a non-uniform pigmentary pattern. You can see that there's more pigmentation on this side, less pigmentation on this side. Already that tells you, likely something sinister going on. And you can see that there are some maple leaf-like areas in the periphery. There's arborization. So when you see this kind of blood vessel, or this kind of features in skin lesion, you need to be referring urgently to the dermatologist for an excision biopsy. Okay. This photo clearly illustrates a blue veil, and you can see some whitening as well, some whitish streaks within this lesion that tells you there's likely, an ongoing destructive process and fibrosis within this lesion. You can see the maple leaf areas. You can see it's like a maple leaf. We can't really see arborizing blood vessels within this lesion, or you can clearly see the blue, white veil, the white streaks within the lesion, the maple leaf-like peripheries, spoke wheel. You can see the spoke wheel peripheries. These already tells you it's a highly suspicious lesion, and most likely going to be a basal cell carcinoma on histology. Excuse me. This other lesion shows you ulceration. That's a blood clot. That's an ulcerated part of the lesion. You can see so many arborizing blood vessels, branching blood vessels. You can see this whitish area around, telling you there's ongoing skin tissue destruction and fibrosis. Yeah, someone could call that maple leaf-like area. Well, not clearly, not distinctly a maple leaf-like area. Let's look at the periphery. Well, yeah, you can see some pseudopod kind of. It looks like a pseudopod, like a leg. Is it like a pseudopod? So those are actually the maple leaf-like. If you look for them, you will find them. Look for them. If you know what you're looking for, then you can identify. So there's some maple leaf-like areas there, not clearly distinct, but we can call that. So we've come to the end of this very short video illustrating the common features. Let's go to the beginning and just revise. So most common features to look out for arborizing blood vessels or branching blood vessels that are a marker of increased vascularity. And as I said, even though other skin tissues, skin malignancies have increased vascularities, because that's what usually drives cancers generally, melanomas, squamous cell carcinomas. But in these, you don't really see arborizing blood vessels in those other skin malignancies. Other commonly identified features are the maple leaf-like areas at the periphery, or spoke wheel, spoke wheel appearances at the periphery, and this blue-white veil appearance, as though the lesion has been covered with a blue veil. See that blue hue around the lesion. These are commonly identified, and sometimes you find the dots. You create the ovoid, the blue dots, or the blue-gray dots, or blue-gray, globules. When they are bigger, when they're small, like you see those small ones, you call them dots. When they're bigger, bigger like these, you call them globules. Okay. When you see this kind of features, tells you that the skin lesion is likely to be suspicious for a malignant process. So thanks for engaging. Like, subscribe to my channel. I will do some very short videos on other dermoscopic features of melanomas, squamous cell carcinomas, on some benign skin lesions like seborrheic keratosis, benign melanocytic nevi. So watch out for those videos um, as I roll them out very shortly. Thank you.